Hi, this is the next video on healthcare communication skill series. And up till now, what we have discussed are the verbal tone and verbal accent, how we deliver the message verbally. And we have been emphasizing on the attitude of the physician or healthcare worker, and we have been concentrating on delivery of our message to the patient or our colleagues. Now, in this video, we will emphasize on the documentation part of it because not only the verbal communication is important, but the documentation is also important for those who are not around us or who are going to follow that patient or who are going to see that patient after us or who are in the continuity chain of the patient care. So, we will discuss in detail what these healthcare communication regarding the documentation should be. Now, it is said that it is not, if it is not written, it did not happen. Means that what you are not writing, it means you have not done it. Or what is not in the record, it means whether you are telling that I did it or he did it or she did it, but it is not authentic that it has been done or not. Whether you bring the evidences or whether whatever you bring it. So it is essential for the healthcare worker that he or she should document whatever he or she is doing for the care of the patient. Okay, there are some times when it is not possible at the moment to document all the things in detail, but write something briefly and then later on document it in the detail so that the person who is in the continuity of care chain should uh, understand what has been done with this patient. For example, a patient comes in ER and he is in pain, dealt with the ER doctor and the nurse, and given the analgesics. Now you know the analgesics are given, even all the medications are given at some time differences, like after 4 hours, after 6 hours. So the patient arrives in the ward after admission within an hour. And if it is not written that analgesic has given, definitely after 1 hour the patient's pain might not have been reduced because the definitive management has not been done for the fracture patient or abdominal pain or some other illness. So, if this is not written, what has been given, the name of the analgesics or the event that the analgesics has given, so it leads to the duplication of drug and may have hazardous effect on the patient's health and the care of the patient. So it is very important that we should document it clearly and timely before the next episode of care or for the continuity of care before delivering the patient under the care of some other healthcare individual, whether it is a nurse or whether it is the physician itself. And it is also important for the legal record of the patient. So, retrospectively, when we go and see the patient, what has been done with this patient, if there is any complaint or there is morbidity and mortality meeting, or retrospectively to assess the management criteria or in for the research purposes, or see the continuity of care chain that it is followed or not, or the clinical pathways. This is very important to document each and every event, whether it is intervention, medication, or examination. It is also important to improve the quality of patient care, and it is also important to assess the clinical pathway which the physician is following, so that this clinical pathway will be authentic with the improvement. Otherwise, if there is any deviation of the clinical pathway, then we can assess it from the records. Also, there are risk management domains which assess the safety of the patient. They do the safety audits, and in these safety audits, they see the clinical pathways. If these clinical pathways are followed properly, and even that after that the patient has some issues in the management, in their management, so it is not the fault of the physician, not the fault of the system. It means that accurate clinical documentation with clear and timely evidences is very important for the patient care and their future management of the illness. But the documentation should be objective and the professional tone. We should avoid the unnecessary medical jargons, unnecessary stories about the patient during the care. Usually, only the recommended abbreviations are written, but there no assumptions should be written that we should expect this, we should expect this. We have been given analgesics, so after we are expecting that 2 hours after the patient's pain is subsided, or we are trying to manage this patient conservatively and we are expecting that it will heal conservatively. No assumptions. We should give an evidence based practice documentation. We should write this documentation with the criteria that the dates and timings should be written. A patient is given an antibiotic, no timing, no date is written. So it means there is a defect of documentation. Sometimes the progress notes or the continuity of care notes or the ice bar notes are copy pasted. So, what is the hazard in this? I give you one example. The patient is admitted, planned for OR, staff written the notes, physician write the notes, patient went to the OR in the morning, patient is planned to go for OR after a day. In the notes it has been written that the patient will be having OR on a scheduled operating day. But the next day there is an available slot for the surgery and the patient is operated. The physician or the nurse was not present at that time in the morning. Her or his duty starts in the afternoon when the patient has already been operated. She or he comes and do the pasting of the notes from the copy pasting because there is an overload. So she will write the patient is planned for OR tomorrow. The patient should be NPO from the midnight, will be given the regular antibiotic dose and should be restrained for some medications which is not uh, recommended before the surgery. So there are copy paste errors, which is a defect in the ISPA or the communication protocol between the outgoing and incoming staff. Also, in the uh, documentation, we should not write our emotional words or subjective opinions. A physician is writing, for example, a physician is writing that we have been treating this patient, but the other colleague is ignoring this patient because he has a large workload or something. These kind of documentation should not be done. Or I am treating this patient conservatively because I think in my experience it will heal by the conservative management. Or we are going to open the abdomen of the patient for exploratory laparotomy because in my experience this pain is related to the intestinal perforation. So you don't have to provide your own experience on or the subjective experience or subjective opinion. You have to provide the clinical based, evidence based documentation so that even when you go for negative laparotomy or if your treatment fails, the evidence based uh, criteria can help you to avoid the claim to prevent the complications of future uh, claims. This gives us the message that the proper timely documentation, which is clear and professional, is very essential. And these documentation should not be sent through the WhatsApp or messages or emails. The EMR notes are the confidential ones. It needs a healthcare professional to be showing the professionalism. This data should be secured, or even if they want to discuss with their colleagues on the WhatsApp or email messages, should hide the identity or should not uh, tell the name of the patient or MRN number of the patient like this. For example, one doctor wants to discuss one case with their colleagues, which is overseas or in other part of the city or other part of the country, can talk like this. I have one patient which has a osteolytic lesion of the proximal femur without pain. He is walking, suddenly he fell down and had a fracture. So, what is your experience in this? How to manage this? How to evaluate this? Instead of saying, I have a 30-year-old patient which is living in this part of the city, he is this, and you should not declare the identity of the patient. So, confidentiality is most important while sharing the data of the patient. Okay, whatever now you are documenting, you have to make a plan of management, which is the most important thing in the documentation. The plan of management should include the reason of the plan and what is the urgency or what is the timing of that plan. I wanted to do emergency laparotomy. I wanted to do emergency fasciotomy. I wanted to operate this fracture shaft of femur urgently. Or I wanted to postpone this patient because there is a swelling around the ankle and it should be subsided before I go for surgery to facilitate the eventless healing. So the plan should be clear, professional, evidence based, and you have to be concise, not elaborative too much that it lost the details or important details. We should not write, or a physician should not write that this patient is planned for surgery, but because the OR is delayed and the patient has no money and the patient's relatives are not there for signing, so we delayed this surgery and then the swelling increases. So we are waiting for decrease of the swelling. After that, we arrange the OR. So unnecessary details should be avoided to avoid the future complications. So, clear writing reflects clear thinking of the physician, and documentation, proper documentation, is very good communication. So, the 50% of the communication skills includes the proper documentation of the physician. With this, we finishes our this video. Please stay tuned for the next video. We are still in the healthcare communication series. Thank you.